eloquently speaking. Welcome back to another episode of Legal Talk, where law meets justice and advocacy becomes action. I'm your host, Dr. Vickie Simon, and today we're discussing the hidden crisis in American maternity care, birth that is now being used for profit, and how hospitals are betting against mothers' lives. The United States spends more on childbirth than any other developed nation. They are spending more than $14,000 per birth on average, and sometimes far more depending on the intervention. Yet, despite all this spending, maternal outcomes are worsening, maternal mortality is rising, and complications during childbirth are increasing, and Black women are dying at rates 3 times higher than white women. Now, you're asking the question why? And it is because the system is now structured not to prioritize life, but to prioritize profit. Hospitals and providers have incentives, financial, legal, and administrative, to intervene, perform procedures, and schedule surgeries even when they are not medically necessary. Now let's consider these numbers. The U.S. C-section rate is 32%, more than double the 10 to 15% recommended by the World Health Organization. Unnecessary surgeries have increased infection risks, hemorrhaging, recovery time, and complications for future pregnancies. And families often pay thousands of dollars, sometimes tens of thousands of dollars, for procedures that were not necessary. Most mothers trust their providers, but the reality is this: the system is exploiting trust to maximize revenue, minimize liability, and standardize interventions that are not needed. This is not a medical error problem. This is a policy and administrative problem. Incentives are now misaligned. Oversight is weak, and vulnerable women are paying the price. Now, there are several structural forces that are shaping these outcomes. Number one is insurance reimbursement models. Hospitals often focus on receiving higher payments for surgery than for natural or midwife assisted births. Number two is the malpractice fears. Now, defensive medicine drives preemptive procedures to avoid lawsuits. Number three is hospital staffing pressures. Limited staff, tight schedules, and rigid protocols are pushing interventions over individualized care. And number four is underfunded alternative procedures. Midwives and doulas have proven to reduce unnecessary interventions, and they are often excluded from the hospital systems. Now, together, all these factors prioritize profit and legal protection over patient-centered care. Now, these statistics are not just numbers. They are lived experiences. For example, Jasmine is a Black mom that went into the hospital expecting a vaginal birth. The hospital procedure pushed her into a C-section. She did not need that C-section. Her recovery was slow. It was painful. She developed an infection and she was separated from her newborn for days. That emotional and financial toll on Jasmine was absolutely devastating. Another example was Maria. She is a low-income Latino mother. She was told that she needed an induction because she was only able to access a hospital that prefers scheduled births. Now, this procedure caused her complications. She had to stay in a hospital. She sustained a medical bill that she could not perform. And until this day, we are trying to understand what was the underlying issue that she needed a induced birth. Now, across the U.S., hospitals drive for efficiency and revenue-shaped outcomes. We know this. But families are paying for unnecessary interventions. Black and Indigenous women are disproportionately impacted, and providers are pressured to act in ways that protect the hospital and not the patient. This is not just unfair, it's deadly. And each unnecessary C-section, each unnecessary induced labor, or profit-driven intervention just adds risk, it adds trauma, and it adds financial burden, especially for mothers that are already vulnerable. Now, public administrators and policymakers can take immediate action. They can fund midwife and doula programs that have evidence that doula supported births reduce C-sections, they reduce preterm births, and they improve maternal satisfaction. They can reform insurance and reimbursements, and they can pay for outcomes, not just for procedures, and they can support community-based and natural birth options. They can strengthen regulatory oversight, track unnecessary intervention, and require reporting and hold institutions accountable. They can train and support culturally competent providers, especially those that are in underserved areas. Now, with proper policy, with proper oversight, and public administration, we can reorient maternity care to prioritize mothers and babies over profit margins. We must demand transparency. We must demand equity. And we must demand accountability in maternity care. We need to advocate for policies that expand access to midwives, doulas, and birthing centers. We need to support legislation that aligns insurance reimbursements with outcomes, not just the volume of procedures. And we need to educate our communities about birth options and patient rights. We need to hold hospitals and administrators accountable for over-medicalization and its consequences. Let this be our mantra that birth is not a business. Maternal health is a right, and profit should never outweigh life. Now, if you're asking, why is this episode important? And why must we keep this momentum? It's because in 2023, data showed that Black women still face maternal mortality rates of 50.3 deaths per every 100,000 lives birthed. That is a racial gap that must not be ignored. This episode is important because maternal morbidity, which includes complications, chronic health issues, and postpartum care gaps, affects far more women than mortality alone. And many of these burdens are preventable with better policy and care. This episode is important because our institutions, public administration, health departments, and community agencies have the power and the responsibility to change this narrative. And this episode is important because each life that we save, each healthy birth, and each stable family that sees this victory is not only impacted individually, but it impacts generations to come. Now let's continue this work with urgency. And let's continue to push for clarity. And let's do this with our heart. Now, if today's episode moved you, organize. If it informed you, share it. And if it challenged you, begin to plan. And if it reminds you that power lives in people, then act. When fear breaks us down, strategy builds us back up. Legal talk is not just commentary, it's resistance. It's a call to action and a reminder that justice does not come from silence alone. Thank you so much for tuning into Legal Talk today. I'm your host, Dr. Vickie Simon. I love you, and I'll see you on the front lines of reform. Until next time, stay informed, stay ethical, and keep serving your community.